Today we will revise some concepts about bifocal contact lenses. By the end of this presentation, the audience are expected to be able to describe the methods to correct presbyopia using contact lenses, mention the types of contact lenses used in keratoconus, and mention the common complications of contact lens usage. So we have three main options available for presbyopic correction. Number one is that we use reading glasses for near vision and contact lenses for far vision, and this is the most convenient and inexpensive method. Number two is the option of monovision, and number three is the option of bifocal or multifocal contact lenses. So we'll come to monovision. In monovision we use two contact lenses, one for each eye. For the non-dominant eye, we'll use the contact lens for near vision, and for the dominant eye, we'll use the lens for far vision. It has some disadvantages, like obviously both eyes are not being used for the same purpose, so we'll have a reduction in binocular single vision formation, and depth perception may also be disturbed. Now the third option is bifocal contact lenses. As the name implies, a single contact lens is used for both purposes. There are two types: alternating vision and simultaneous vision. First we'll come to the alternating vision contact lenses. In alternating vision contact lenses, the retina receives one focused image at a time, either from the distance or from the near. There are two main structural types. Number one is the segmental or segmented, and the second one is concentric with concentric rings. One portion is used for near and the other is used for distance. Now if we might be thinking that whenever we move our eyes, the contact lenses are moving with our movement of the globe. So how will we able to use both these portions? It is explained in this diagram. In this diagram, the eye is looking straight forward and contact lens is in primary position. However, if we have some near object over here, the eye will look downwards, but the lower lid will hold the lens in its position. So automatically the axis of gaze will be directed towards the reading portion of the lens. The second type of multifocal lenses is simultaneous vision lenses. In these types, the retina receives two images simultaneously, and now it's up to the brain how it works to focus a single image at a time. One disadvantage is that there is reduction of contrast sensitivity in these types of lenses. So these are simultaneous vision lenses. It may have concentric rings, diffracting rings with different focal lengths, making images for far and near. इसका answer. C. Keratoconus is irregular astigmatism with myopia. We know keratoconus is basically central or paracentral corneal thinning, and in mild cases we may use soft contact lenses. However, mainly we have to use rigid contact lenses. Previously there was the use of haptic contact lenses, which I will explain later on, and in severe cases we ultimately have to proceed towards keratoplasty. These are haptic contact lenses or scleral contact lenses. As you can see, the peripheral portion are called the haptics, and the central portion is the optic portion. You can see that the lens does not rest on the cornea. So basically these are used for correction of astigmatism in corneal ectasias, because they are not resting on the cornea, so they can be used for ectasias or corneal thinning like keratoconus. And secondly, they are helpful in certain ocular surface diseases as well. Now we have contact lens related complications. Short-term complications are that As we blink, there is slight movement of the contact lens which can lead to disturbance in visual acuity for some time. Second comes the coated power. Whenever we see whenever there is a mention of the contact lens power, it is actually on the basis of its presence in normal saline at room temperature. But on our eye there are different refractive media and different temperatures, so there is slight change of power whenever we use the contact lens. The long-term or more serious problems related to contact lens are categorized into three main headings. First come the infections. There are three basic types of infections which can occur: bacterial infections, viral or fungal infections. The atypical ones are acanthamoeba, fungal keratitis, and Pseudomonas infections, which are very serious and which may not be eliminated by normal cleansing mechanisms. Second category is hypoxic or metabolic problems. Three main mechanisms are behind these: oxygen deficiency, lactic acid accumulation, and carbon dioxide accumulation. So further types are: number one, settler wheels edema. It is actually corneal edema which occurs after a few hours of contact lens usage, and it may either settle down after discontinuation, or it can ultimately lead to acute epithelial necrosis, and it is mainly associated with the use of rigid contact lenses. Second is microcystic epitheliopathy. These are small cysts which are best observed on retroillumination, and either they may be asymptomatic or may present with epiforearm episodes of pain. The third option is complication is corneal neovascularization. As we know that ischemia always or most likely leads to neovascularization. Contact lens overwear or prolonged usage can lead to all these problems. Neovascularization may be either superficial or deep, and the neovascularization may ultimately lead to scarring or intracorneal hemorrhage. And in differentials we can add chlamydial conjunctivitis or keratitis or chemical injury, etc. The third category is toxic reactions. Toxic reactions, one point is that all these problems may be either due to the contact lens itself, or due to its lensing solutions or preservatives used. The body responds to these things, and these complications may occur. So in toxicity we have punctate keratitis and toxic conjunctivitis. In mechanical problems, the most important is corneal warpage. It is the change in the shape of the cornea due to prolonged usage of contact lenses, and it is mainly associated with hard or rigid contact lenses. And due to warpage, since there is, we have to monitor this warpage via the keratometry and topography. So it may lead to a false impression of that we have calculated the contact lens power wrong. Warpage leads to changes in curvature, and refractive errors are produced, and so we think that we have not calculated the power correctly before. And the second one is corneal abrasions. Corneal abrasions may occur due to poor technique of using and disposing of the contact lens, or some foreign body under the contact lens, or a damaged contact lens. Staining. The contact lenses may lead to deficiency of tear meniscus, which can lead to staining in the, particularly in the perilimbal areas. I have added the diagram. I'll show you. This is the staining occurring in the perilimbal area. This is either most likely 3 o'clock or 9 o'clock position, and so it is also known as 3 or 9 o'clock staining. And if the periphery of the lens is thick, then this also leads to this type of staining. And next one is ptosis. Prolonged or continuous usage of contact lens may lead to dehiscence of levator aponeurosis or its damage, and this can lead to ptosis. The next category is inflammation. as I have already explained, inflammation may occur due to the toxic reactions to the contact lens solution. Or so number one is contact lens induced keratoconjunctivitis. Then we have allergic reactions, and these allergic reactions are not type 1 hypersensitivity, they are type 4 hypersensitivity reactions. Then we have sterile infiltrates. These are sterile because the cultures are negative. These are the sterile infiltrates. And the last one is giant papillary conjunctivitis. Giant papillary conjunctivitis, papillae are known as giant papillae when their size exceeds 0.3 mm. And when the joining septa are disintegrated, then the giant papillae are formed. It may present as pain, burning, watery discharge, or mucus coating of the contact lens. And if there is superadded inflammation, so here it may lead to bloody discharge as well. And GPC is mainly associated with soft contact lenses, not hard. And in treatment, we have the same general treatment like anti-allergics, steroids, or immunosuppressants. These are the giant papillae, and that is a Pseudomonas corneal ulcer. And you can see vascular pannus mainly occurs on the superior cornea. These are the sterile infiltrates. Then
ये तो पहली स्लाइड